Hello and welcome to another informative edition of NAFDAC and Your Health. This is where you get first-hand information about NAFDAC's daily endeavor in safeguarding the health of the nation. My name is Tosin Omolaja. Shopping for food and other regulated products, including drugs and cosmetics, can be for a vast majority of people an overwhelming task. Shoppers sometimes spend significant amount of time in supermarkets and even open markets trying to make what will be for them the best buying decision on the day. However, making a decision on consumables that have direct impact on our health and well-being shouldn't be limited to the obvious parameters like pricing, packaging, and popularity. As a matter of fact, when it comes to food, drugs, and cosmetics, especially at a time of pandemic such as we are experiencing now with the raging coronavirus, the content of the labels should be the first and most important consideration for making a buying decision. One of the most important requirements for getting NAFDAC's nod on any regulated products is a properly outlined label. With this, the agency is able to verify every single claim made by the producer of such products to be sure that what is said to be in the package is true and that it is fit for human consumption.
We have to educate ourselves in terms of labeling. I can spend 10 minutes to read the label on a particular product. Before, there are some chemicals that will be given general name in the US. Now, you cannot do that. You have to specify the names of each additive or component. So you don't use general name. But I take that seriously because either I listen to what FDA is saying or I read about it. Thank God that I'm educated enough to understand. And maybe because of my own profession, I take time to read the label.
A food label is the information found on the pack of a food product. It is a mark, a brand, pictorial, or any other form of description written or printed on the container of a food product.
Labeling is huge for us in NAFDAC. It's huge because we have to be in compliance with the best practices and standards, food standards, drug standards, things like that. It has to be well labeled so that the consumer will be able to read it and understand. People may not even know the effect of salt in the body, not to talk of glutamate or X other components. So that is where our own advocacy and enlightenment comes in.
Manufacturers of regulated products are mandated by law to submit their products to NAFDAC for approval, giving details of the raw materials and ingredients put together to make the products.
Labeling gives you information about the food. It talks about the date, it talks about the storage condition, it talks about the content. It gives you information about the allergy, so that before you take any food, you must look at the label. And labels should be made in such a way that it will never deceive. From label, if you make your label to be deceiving, then you have bad intent. And NAFDAC is against that.
Besides being a truthful declaration, it needs to not mislead the consumer. It should not be deceptive. It should not confuse the consumer. And it should not give an erroneous impression of what the product is.
When you don't add something and you say that is added, they say that vegetable oil is cholesterol free. It's unnecessary because all vegetable oil, they have no cholesterol from the word go. So how can you claim that it doesn't have cholesterol? We know that it is cholesterol free. Therefore, it's not what you didn't do anything to remove cholesterol, but naturally it does, and naturally it contains vitamin A. So no one should go and claim that this oil, vegetable oil, is cholesterol free or contains vitamin E. It's only when you add it. So we should be careful not to give false information on labeling or misleading information. When you have used the carbohydrate to produce something, you say no sugar is sugar free. It's not sugar free because the carbohydrate will disintegrate to give you sugar. Though you didn't add sugar, you may claim no sugar added, but not sugar free, because there is sugar naturally in it. So all labels should not be misleading.
So say for example, we have some products that have pictorials of fruits, say like fruit juices for example, and you have maybe apples and pineapples, oranges on the product label. But this product really is not a fruit juice, it's just a flavor. The consumer seeing the pictures of the fruits on the product label assumes that this is a fruit juice. So it is important to read the label and read the ingredient list, because the ingredient list will tell you if it is a flavored drink and not a juice.
Beyond identification and true representation of the contents of food, labels also help consumers identify food or food brands that carry essential nutritional additives that are required for the Nigerian populace, like iodine in salt and vitamin A in vegetable oil.
The regulation in Nigeria is that all our vegetable oils must be fortified with vitamin A. These vegetable oils that are being retailed, unpackaged, unlabeled, we are not certain, we are not sure that they are fortified with vitamin A. And even if there is a food safety event, there is no way we can actually trace it back because it's not labeled and it has no address as to where it was purchased. You know, if somebody told you I purchased it from a particular address, as long as that address is not indicated on the label, the person can even deny that it was purchased from there.
To guarantee safety of food sold in our markets, including oils of different categories, NAFDAC carefully scrutinizes all such regulated products to ensure safety and wholesomeness in its laboratories.
Here, we test for the presence of vitamins, which are mandatory fortificants in food, such as oil, margarine, flour, as well as sugar. Most of the vitamin, fat-soluble vitamin in question are vitamin A and sometimes D and E. Then we have the water-soluble vitamins such as folic acid, vitamin B1, vitamin B2, B6, even B12, which are supposed to be present in food to provide good healthy living. For example, if you don't have vitamin B2, it can lead, which is riboflavin, it can lead to medical situations. Sometimes we refer to some of them as scurvy. For vitamin C too, we have to determine the presence of vitamin C. So these are the parameters that we analyze here in the food lab.
Drugs are also strictly and carefully analyzed at the NAFDAC drug laboratories.
For laboratory testing activities, there are 3 levels. We have the level 1, level 2, level 3. Level 1 is the physicochemical parameters, which includes physical appearance of the product. The physical appearance of the product starts from the package itself. What are the basic information on the package? If a product, for us, we look at the brand name, the generic name, and we look at the strengths. What strengths if they say, okay, this is omeprazole 20 milligram, then the specification, British Pharmacopoeia. Okay, that means this product was produced according to British Pharmacopoeia standards, and it has 20 milligrams. So that is what we are going to target when we are testing it. We are going to make sure that we go through the official monograph of this pharmacopoeia that says it's 20 milligrams and make sure we test according to this, and if it's confirmed, good, we award correct disposition that this product is okay. But if it is not, then it has failed. It must meet what it is on the label. That is what we actually look for in the laboratory.
We take all necessary precautions and we try to ensure that whatever people use and package and say they want to sell to the public is, safe for them to consume. It's safe for everyone to consume. And we do thorough work on it, which includes laboratory checks. And then we also do a lot of literature review to check, to know whether certain combinations, where certain materials can be used or cannot be used, so there's a lot. And we're also members of several international organizations, like the Codex Alimentarius Commission, which is a WHO, FAO joint, organization, where a lot of things on food safety and food standards are actually discussed and agreed upon. And anything we do, we follow those standards.
Food presented to the consumers to be consumed nationwide is also meticulously monitored by NAFDAC to ensure the circulation of healthy food products in Nigeria.
We look at, what food is available and if they are safe for consumption, and then if they provide the required nutrition. We expect that any food that is presented to consumers to eat is honestly presented. And when we say honestly presented, is that you do not present something and claim it is not what it is. For instance, you cannot present a food that is loaded with carbohydrate and say this food is rich in protein or fats or whatever other nutrients that the body may need. So we check to make sure that the food is correctly labeled. We ensure that it is safe. We ensure that it is honestly presented to the public and to the consumer.
We'll go on a short break. Don't go away. Welcome back. In case you're just joining in, you're watching NAFDAC and Your Health. There are a number of necessary information that labels of regulated products must supply, and in a specific format. Only then can the label be deemed to be in line with acceptable standards.
The Prepackaged Food Labeling Regulation 2005 specifies specific information that are expected on every food labels. Things like the name of the product, name and address of the manufacturer, the batch number or lot number, manufacturing date, and the best before dates, among other information.
The name of the product is the first a label should tell on the principal display panel. This is the product's identity that tells a potential consumer what the product is. It is also necessary for the label to clearly state the product's packing medium, like in the case of tomato sauce and other similar products. Another important information that a label should carry is the ingredient listing.
Now, the ingredient list needs to state exactly what ingredients went into making this product in the descending order of proportion by weights going in for production. That means the consumer can pick up the products, look at the ingredient lists. Yes, look at the ingredient lists and be able to tell from the way the ingredients are listed which particular ingredients is most, right? So it goes from the most to the least. So say the consumer is trying to avoid sugar and you pick up a product and you see sugar as the first ingredient, you know that that is the most.
It is also mandatory that the manufacturer of a product, through precautionary statement, gives information on ingredients that could cause allergic reactions so that the consumers could beware.
A major information that is, so very important also is labeling on allergen caution on food products. There are certain individuals, for example, by their bodily constitution, who don't tolerate certain ingredients in some food. Some people don't tolerate lactose. That's in milk now. So if they take, there are about 8 classes of products. If they take from these classes, they get some reactions. Some of those reactions could be fatal. So it is expected that there should be an indication to show that this product contains this, for example, so that the individual that is buying will be able to make informed choices.
Date markings and storage instructions are also very important information a manufacturer is expected to disseminate to the consumer of his products through labeling. Date markings include the product's manufacturing date, the expiry date, and the batch number.
For food, we talk of best before. That means this food remains best quality, before this for certain categories of food. But for some, we can say, some manufacturers used to use the term expire. And the expiry date is a date beyond which the producer is no longer responsible, can no longer guarantee the safety and quality of the items.
Of course, we know that if a product is expired, it's no more suitable for use. So care in making sure that we are guided by labeling will also let an individual know that, oh no, this product is expired, even though it's not expected that an expired product should be on the shelf.
If you don't follow the conditions that is recommended, even if you say something's shelf life is so, if you don't store it in this prescribed condition, the shelf life is shorter. So if they say store in a cool, dry place, and you store in a cool, wet place, it will not last.
The net content, which is the volume of the product packaged in the pack or container, is another information that a label should carry. A label is also expected to have a nutrition fact panel, which should state in a simplified manner the nutrients contained in the products and their volumes in a descending order. The language in which the label is written is very important. Otherwise, the label would be of no essence to the consumer. For instance, a product manufactured for the Nigerian market should be written in English language, which is the official language. The manufacturer could also choose to write the label in the major indigenous languages. Of utmost importance is the need to ensure that a regulated product carries a NAFDAC number on its label. This is an important mark of endorsement that certifies that NAFDAC, the regulatory agency that has the mandate to safeguard the health of the Nigerian people, has approved the product and declares it fit for use or for consumption, as the case may be.
Whatever we have a stamp on is actually safe for the people, for the population to consume. So if we are not too sure, we will not, because we are trying to hurry to issue a number to somebody and then release something we are not sure of.
It's time we bring you the news on NAFDAC Update.
NAFDAC advocates good hygiene practice in food handling and preparation. NAFDAC has reiterated its call for proper hygiene, especially with food handling in this time of the coronavirus pandemic. It is imperative for food industries to reinforce adequate hygiene measures and good manufacturing practice in food handling, processing, and preparation to help reduce the risk of food surface and food packaging materials becoming contaminated. On the other hand, consumers must also ensure adequate hygiene practices are maintained at home in food handling and preparation before its consumption to maintain a good health status, especially at this time.
Currently, there is no evidence that SARS-CoV-2, that's the name of the virus that causes COVID-19, there is no evidence currently that this virus can be transmitted by food. And there is also no evidence to show that the virus can grow on food. A virus requires a living host in order to be able to multiply, and food is not living, okay? So the virus is not likely to survive on food. Now, the best way to avoid COVID-19, okay, is the way, the National Center for Disease Control and the Federal Ministry of Health, there has been a lot of public proclamations and awareness going about. The best way to avoid COVID-19 is through good hygiene habits.
Safety measures to practice against COVID-19. The National Agency for Food and Drug Administration and Control, NAFDAC, implores Nigerians to strictly comply to the safety measures published by the Federal Ministry of Health and World Health Organization to ensure that the spread of the coronavirus is curtailed. Research is still ongoing to further understand the nature of the virus and provide vaccines for it. However, the public are advised to constantly maintain safety measures against COVID-19. Always wear a face mask when you are outdoors. Wash your hands with NAFDAC-approved alcohol-based hand sanitizers. Maintain social distancing. Avoid crowded places. Cover your mouth with your elbow when you sneeze or cough, or use a clean tissue paper and ensure that it is disposed properly and immediately.
For somebody to be sure that the mask is protective enough, the thickness is extremely important. And NAFDAC is going to be testing that, not because we're supposed to, but because we want to safeguard the health of our own people, so that anybody that is going to be making masks now will know that they should choose the fabric carefully. If somebody has a barrier mask on and another person lights a cigarette lighter, for example, and that person can blow that cigarette lighter off, the barrier mask is not protective enough. If the person cannot blow that cigarette lighter off, then it is protective enough. It's a simple test, and I believe that our people can easily do that. We are very good at making sure that things are okay if we are guided well.
NAFDAC bans 30 pesticides. The National Agency for Food and Drug Administration and Control, NAFDAC, has banned 30 pesticide products from being used in Nigeria due to their tendency for causing harm. The banned products include aldrin, binapacryl, captopril, chloridane, clodimefom, DDT, dieldrin, dinoseb salt, heptachlorlidane, and other pesticides, insecticides, herbicides, fumigants, disinfectant insecticides, and so on. The general public is hereby advised to stay alert and vigilant. Distributors, supermarkets, and other sales outlets are hereby warned to stay clear of these banned products. For a comprehensive list of all banned products, please visit nafdac.gov.ng. NAFDAC warns against unregistered products. The Director General of NAFDAC has warned Nigerians against the manufacture, sale, importation, and exportation or use of products that are not registered with the agency. If a product is not registered with NAFDAC, there's therefore no guarantee of its efficacy or wholesomeness. The role of NAFDAC is to act as a safeguard for regulated products, so when such products, whether food, drugs, chemicals, or cosmetics, are imported illegally and without NAFDAC approval, they are most likely fake or unfit for use or consumption in the country. In the same vein, the Director General reiterated the agency's commitment to ensure the manufacture and use of quality drugs, food, and other regulated products by Nigerians in spite of the COVID-19 pandemic, thus imploring importers, wholesalers, distributors, and retailers to desist from the dangerous act. That's it on NAFDAC Update. You've been updated.
This is how far we can go on today's edition of the program, NAFDAC and Your Health. Hope you've had an informative time. Join us again next week, same time, same station, for another informative edition. Remember, safeguarding the health of the nation is our collective responsibility. So report fake and unwholesome food and drugs and activities that create them in your area. You may have questions, comments, or inquiries. Kindly contact us. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322 For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. Till next week, stay safe.